Okay, Carly, as you know, the sun is setting earlier right now. Temperatures are dropping, and we all may be feeling a shift in, how we are feeling mentally.
Yeah, and you're not alone, because this could be a phenomenon called seasonal affective disorder. Dr. Sarah Getch from Kansas City University joins us this morning with how to identify and manage these feelings. Good morning, Dr. Getch.
Good morning.
Yeah.
It's good to see you.
Good to see you.
Absolutely. Happy to have you here. So talk to us about the seasonal affective disorder. I know it's acronymed SAD.
Yes.
What is it exactly?
Appropriately, right?
Exactly,
yes.
yeah.
So seasonal affective disorder is a type of depression. So it could be just as serious as depression, although some people don't think about it that way. So a lot of the symptoms are going to be the same. You're going to feel sad, down, depressed, maybe some fatigue, a loss of interest or pleasure, maybe your sleep's disrupted, and then particularly with SAD, you might crave carbohydrates, and there might be some small weight gain, which, do we really need this during the holidays? Probably not. Probably not.
What are some of the ways that we can, counteract that?
I can give you some really easy ways to start to counteract this. So one way is to get outside when it is sunny and bright. So today is a great example. At lunch, go outside, take a walk. The exercise is going to be good for you, but then also just exposure to that sunlight is also going to be really helpful. Keep your curtains open, turn the lights on, and then another really important piece is have regular sleep routines and regular sleep behavior, because that will really help.
Can I follow up on that? People who may have mobility issues may not be able to get outside and may not be able to walk. I've heard that something that's called a light box can also work. Is that something that still can work today?
Yes, so light therapy has been shown to be effective for individuals, and so what happens is you buy a specific light box and then you learn about your circadian rhythm and when you should be exposing yourself and for how long to that light. I would suggest that you do that with a provider, either your PCP or your psychologist. And if you or anyone in your family has a history of bipolar disorder, you really need to talk to someone before you engage with the light box.
Okay.
Oh, that's good to know. So how does the time change affect our moods? Because even I feel like, I'm productive during the day, then 5:30 comes around and I'm exhausted.
Right.
I'm so tired.
I totally understand. That's how most people react to this sort of hour shift and change, because it exacerbates those feelings of fatigue and being tired and wanting to go to bed early.
Yeah.
Right. And so it has this big impact, mostly around how we feel, our energy level. And really what's happening is it's impacting our serotonin levels, so reduction in production of serotonin, and then also the production of melatonin is impacted because we're exposed to less light.
I see. You talked about light as a form of therapy for this. So are there any other ways, whether it be diet or anything else, that may be able to improve our moods?
Well, always having a healthy diet is really important. That can be helpful, but staying social can also be really helpful. Really not just social media, obviously, but really connecting with other people, because you might have a tendency to withdraw, right? It's dark outside, so you want to stay inside. But I want to push you to really start to use those connections and that social support that you have around you.
I'm so glad you said that, because this Sunday, it's dropping in temperatures, and I was about to back out on all my plans because it's too cold, and my friends are like, no, we're going to the art museum, we're getting out. So
get a cute hat, jackets are nice, right?
And I like that you said that, find little things to kind of bring those bursts of energy. What else can we do to kind of boost our mood during this time?
Also, it's a great time of year to be thinking about others. So get active, be social, and do something for somebody else. It'll feel good.
We hope it doesn't come to this, but if someone has a seasonal affective disorder and, say, for example, they continue to just not do anything about it, and instead maybe spiral and
isolate
themselves. Isolation is terrible. When is it time to go talk to someone and see someone?
So it's really common to have, sometimes people call this winter blues, right? Sort of probably what you're talking about, feeling fatigued, wanting to stay inside. That's really, really common, and it's really mild. But when you get to some more moderate or severe symptoms, that's when we need to start to reach out to somebody. So those are, what you really need to be looking for is how it's impacting your functioning. So is it keeping you from, are your social relationships being impacted, your close relationships? What about work? Are you able to work like you usually do, get up and make sure that you're showing up for people? Really, it's about functioning when you get to that level. So for seasonal affective disorder, usually it resolves itself by spring. And just for me personally, I tell myself, we only have to get to December, what, 22nd? And then we're going to add a minute every single day, 1 minute. So by the end of January, we're looking at 30 minutes. Let's go, right? So that's what I tell myself when I'm sort of dragging in the evenings.
Yep.
Good to know.
13 weeks, I think, is what I think the winter calendar is,
About
right?
that time, yeah.
13 segments on a woolly worm.
Yeah. So
13 weeks.
Marking it off.
Right. Kids count down to Christmas. I count down until winter solstice.
Yes, 100%. Thank you so much, Dr. Getch, for joining us.
No, I'm happy to be here.
Yeah,
Thank
we
you.
appreciate it.